All right, hi there. This is Dr. Shakally at Southern Smiles. I'm here to answer some of the most commonly asked questions about mouth guards, what they're used for, what different materials can be there, how to maintain them, and a lot more. Hope you learn after this video. So the first question is, what is a mouth guard? Why should some people get one? What's the need for it? A mouth guard is a piece of, there's different materials, but it's something that comes in and out of your mouth. Usually it's worn at night, and it is done to prevent you from damaging your teeth while you grind. So that's the biggest thing that I see misunderstandings about. Night guards will not stop you from grinding your teeth. Night guards will simply transfer the damage from damaging this teeth that you only have one set of to a piece of plastic that you can take and toss and get a new one. It's best way to think about it is a piece of helmet for somebody that is hitting their head against the wall. It will help you not damage your brain, but ultimately we need to get to the bottom of why you're hitting your head against the wall and address that, because you will continue to grind. If we don't get to the bottom of why you're grinding, you'll continue to destroy your mouth guards over and over, and your jaw muscles will still take a hit. What are the most common types of mouth guards? I would say a night guard is what most people are talking about and referring to when they're talking about mouth guard. A sports guard that's used during when you're for your child, maybe they're playing football and you want to protect their teeth. Obviously, there's ones that are much more professional for athletes and the sorts. There are mouth guards that are more built for as retainers for your teeth after braces so they don't shift. I would say there's new ones that are coming in that are really cool where they are smart mouth guards. So you wear them while you are playing a sport, a combat sport, or so another one that's coming on the market recently is kind of what's called a smart mouth guard. So think of somebody that's playing kickboxing or they're playing football and they want to track their calories or all those things that we track while we work out. They're not able to wear a watch, a smart watch, or wear a ring. They're wearing a mouth guard though. So some of these features are being built into mouth guards where you can track, have you had a concussion? How much calories are you doing? They're trying to build these same technologies into night guards so you can measure how well you're sleeping, are you grinding. So technology is getting really good, but most of people when they're talking about mouth guard, either a sports guard or a night guard. So the mouth guards for teeth grinding, what are they? How do they work? So these are referred to usually as night guards, but some people really grind their teeth more when they're maybe behind their computer or on their way home or driving a truck. So they can be worn at any time of the day. Obviously, most people do grind their teeth at night. That's when it's involuntary being done, so they wear it at night. It's made out of different materials. There's a soft one. There's a hard one. There's one that's hard on the outside, soft on the inside. What determines which one you use is usually depending on how severe your case is, what material fits best in your mouth, what you can get comfortable with. What they are used is kind of what it sounds like. You are usually stressed or taking a certain medication that's causing you to grind your teeth. And at night, when you are involuntary thinking about it, you're going like this. And that is severely damaging your teeth. They're making them short. They're introducing cracks to your teeth. A night guard is something you wear. You're still going to grind unless you address that stressful situation that's going on in your life and learn to handle it better. But while you're figuring that out, you don't want to damage. If it's going to take you 2 3 months to figure out this stressful situation and handle it, you don't want your teeth destroyed in the meantime. You get a night guard, a few $100, and you damage it. Sure, no problem. You're going to toss it, get a new one. Your teeth, you damage them, it's going to be a very expensive problem. So that's the main reason why people use a night guard. So how can a mouth guard help with a TMJ disorder? It only can help if the DMJ disorder is caused from grinding. So some people may have a TMJ disorder to the joints themselves being damaged over time. When you get a night guard, that may not help as much unless you go and address that issue. But if the reason that you are feeling some TMJ issues, maybe you're waking up with a really sore jaw because you're clenching, grinding at night, a night guard may help with that. It may release your jaw at night that you are not doing that. There's different designs that can be built into night guards where your jaw is maybe open a little bit more, preventing you from that. Usually it does help. But for cases that are pretty severe, then a TMJ specialist might be involved. Some cortisone might be involved into your jaw. Those are really severe cases. But for most people, a TMJ would help. Or for most people, a night guard will help their TMJ issues. So, what are some of the benefits for wearing a night guard during sleep? It's a very difficult question to answer because some people actually have very serious difficulty, myself included, with anything in their mouth. So, you kind of have a dilemma at this point. Do you sleep well or do you destroy your teeth? Rock and hard place. So, when it comes to sleep, a night guard may be able to help if the type of grinding you are doing is stress induced and maybe forcing you to not grind as much and getting you better sleep. And some other people it does kind of the opposite. So it really depends on the issue that's causing the grinding, and you may have to go through a few different designs in order to find the right fit for you, which one works, which one doesn't. These are cases that should not be attempted by people who are inexperienced. Usually a TMJ specialist might be involved. Definitely not something that you want to try to DIY at home and try to find some of those that advance your jaw. We've seen some seriously crazy stuff with people trying to do at home. So, what's a sleep apnea mouth guard and how does it help with sleeping? Sleep apnea specifically means that you are unable to obtain enough oxygen while you are sleeping, leading you to snore, or your brain micro wakes you up to get that sleep and goes back to sleep. It's very, very detrimental in our everyday life. It means lower quality of sleep for kids. A lot of times, their kids are misdiagnosed as having ADHD when in fact they have sleep apnea and they're just not getting good night's sleep. So, a sleep apnea night guard is a very, very specific device. It looks different. A lot of times, it's very expensive. And what it looks like, instead of it just being maybe like the traditional night guard you've seen in the past where you put it on top or on the bottom and then you just move. This one usually you wear, it's an upper and a lower and they're connected. And the idea is that it opens your mouth and pushes the lower jaw forward. So you're going to have to go through different trials to see what's the appropriate amount to open you up and push you forward to get to a point where your tongue doesn't fall to the back of your throat while you're sleeping, blocking your airway. That's in essence what a sleep apnea mouth guard. It prevents your tongue from falling backwards and closing your airway, thus helping you with your snoring, with your sleep apnea, sleeping better. It's an interesting contraption. It's really becoming much more popular nowadays with the increase of sleep apnea, with how people are really not liking their CPAP machines. So talk to your doctor about it. They might not be as experienced with it, but they certainly will know a sleep doctor or TMJ specialist that they can send you to. There are certain mouth guards that are advertised as anti-snoring mouth guards. How effective are they truly in preventing that snoring? I would say they usually kind of are actually. They like I said, usually they rely on a mechanism of how snoring works. Snoring works because usually a person has a very thick neck, small jaw, big tongue. So when they're falling asleep, that tongue has a tendency to fall to the back of the throat. And when you're breathing, that blocks the airway, leading to snoring. So your snoring is just your brain trying to attempt to get more oxygen than it needs. A snoring mouth guard attempts to solve this issue by opening your bite and moving your jaw forward. So allowing more space for your tongue to exist and allowing you to snore less. So usually they actually do work. The negative consequences might be something else, and that usually sometimes you have pain near your TMJ. So I recommend all of those things. When it comes to mouth guards, they are temporary solutions. You ultimately need to get to the bottom of why this is taking place and resolve it at the base of it. So if you're snoring at night, is it a weight issue? That might be helpful. Is it maybe you don't have enough room for your tongue? So braces to expand your jaw might be the solution. So what should somebody look for in an anti-snoring mouth guard? I would say this is something that you should definitely not try to do on your own. Even most general dentists are not experienced with this. Usually the way that it works is that you get a sleep study done. There is these devices that will measure how your airway will open up as we open you up. So the doctor will have you wear this device where it slowly opens up your jaw upward, 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 and measuring how the airway changes in response until we find that perfect size airway, that if you go higher than that, it's going to close. If you go smaller than that, it's going to close. It's a sweet spot. And they do the same thing forward and get to that really extremely perfect, precise position as much as possible. So that's really what you're looking for. After that, it's how strong is this material, how thin it is, how durable it is there any allergies concerning some of those. Those are not going to be a DIY options. These are going to be an experienced provider that knows what they're doing, that has knowledge of the materials, used it in the past. You gotta find somebody that really knows what they're doing. So what's the difference between a custom made mouth guard that you usually get at your dentist versus one that you buy from the store? A lot of times they're called boil and bite, and that's what it's describing it as. You go to the store, it's a stock, it should be small, medium, large. Then you boil that thing and bite it in. Sometimes those work. My explanation to the patients is a lot of times they kind of end up being wastes of money because they're not perfect fits. They're bulky. Usually, patients will not find them comfortable and will spit them out at night. And they'll end up wasting their money on that and then end up buying a custom made, where the custom made one is done by your dentist. They usually scan their teeth or they take an impression. Custom made for you. It's much lower profile, smaller size. It's very hard to take off. So I would be shocked if you're able to, while you're sleeping, push it out with your tongue. Usually you have to push it out. So that's really the main things, is that it's also designed in a way not to open up your bite and shift your teeth when you use it. So how does a dentist create a sleep apnea or a snore device for your mouth guard? And like I said, a lot of times there is a sleep doctor involved that is authorizing the sleep study and interpreting their results. Secondly, they usually do this device that sends ultrasounds throughout your nose and throughout your mouth, and it sends this ultrasound and receives it back and measures the size of your airway. Then they do these tests where you stop breathing, stimulate as if you are having sleep apnea at night, and they see how that airway collapses during that process. Some people, their windpipes are just so strong, they don't really need these kinds of stuff. But some people, the second they have start to lose airway and they start to lose any air, their windpipe even collapses further, making it more difficult. So the way that doctors test this is by measuring, if we open this person up, open their jaw and move it forward, and we move it forward by different measurements. Okay, we're opening this and moving this. It's just a test and trial and error until we find that perfect size where even when you are losing oxygen or you're losing breathing, your airway does not collapse. And they fabricate the snore device or the sleep apnea device according to those measurements. Now you got a mouth guard. How do we keep it clean? I would say your dentist should provide you with a brush and something to keep that mouth guard in. Most of the times you are going to want to just run warm soap and water underneath it and brush it. Every once in a while, maybe like once a week or maybe once every couple weeks, you can go to the store. There's these tablets. Try to choose one that are not super bleach based. They're more moderate. You drop them in a cup of water, drop that in for 5 minutes or so, follow the instructions, and then brush it. That's usually enough. If you are experiencing a mouth guard that's getting really dirty very quickly, no matter what you do, then that's probably a material issue where the material wasn't sealed enough. It's getting bacteria quickly. Talk to your dentist about that. I would also recommend always bring your night guard or mouth guard with you to your cleanings. That way the doctor can take a look. They can professionally clean. We can run it through our ultrasound. And then we may be able to detect an issue with it earlier on. We see some fractures or something and take care of it. So the other question we get a lot of is, how long is this mouth guard going to last me? And the question is impossible to know. If you are wearing it every night and you're grinding your teeth like crazy, I've seen them last anywhere from a couple months to 6 months. If somebody is just a very classic case, earlier on they're grinding, they're wearing it pretty well, I've seen them last also 3 years. So that really depends. If you wear a night guard and a month later it cracks or it breaks or becomes really bad, then you might need a different material, maybe a stronger material, maybe a different design to help it last. I tell my patients 6 months to 3 years. I'll be happy with anything in between. Ideally, we want to make it last longer. I've seen patients last for 5 years. Usually at that point, they want to replace it just because it's a color discoloration issue rather than a functional issue. Can mouth guards help prevent damage while playing sports or grinding during the night? And the answer is absolutely. If you have a child or if you are playing any sort of sports, even ones that you don't really expect a lot of physical contact, but if it's definitely one where you're boxing, you are football or anything like that, we see so many injuries from people not wearing their mouth guards. So save yourself the money and the headaches and the pain from damaging tooth. Wear a night guard. It definitely will help to a certain extent. Is there any risks or side effects associated with wearing and using a mouth guard? I would say not really. One that is not done properly will have some problems. Usually, you may have some shifting of the teeth, especially the ones that you can try to order off of Amazon where it's a DIY, not even a boil and bite, especially ones where they're trying to move the teeth. We see a lot of problems with that. We see people that truly messed up their jaw doing that. But if this is something that's done by a professional, they're done well, usually you're not seeing a whole lot of side effects. Maybe if you're not doing a good job cleaning them, then your mouth will get more bacteria, and that will, your breath will not smell as good. Those are really the main problems we see. Thank you so much for taking the time to watch this video. I hope you'll learn more about mouth guards. I'm a big advocate of them, with the caveat that you must get to the bottom of the issue. You cannot just rely on this temporary band-aid forever. You must get to the bottom of what's causing you to grind your teeth and truly address it. In the meantime, get a night guard. Don't destroy your teeth. Get a mouth guard if you're playing sport or have a kid that's doing that. If you have any questions, give our office a call at 480-530-0755 and let's get you fitted for a nice new night guard. Thank you.